be looking at how to identify and create the next healthcare innovations. And again, we have a stellar lineup for the panel. I would like to introduce the moderator, Dr. Alexandra Bause, who's co-founder, investment director, and head of VentureLabs at Apollo Health Ventures. Please join me in welcoming Dr. Alexandra and her panel to the stage.
Thank you and welcome everyone. It's an honor to be moderating this panel with this stellar lineup. Maybe to give a quick round of introductions, I would like to ask the panel to briefly introduce themselves, starting with Her Excellency Hawaa Mansoori.
Thank you. My name is Dr. Hawaa Mansoori. I am a member of the Federal National Council. I'm also an endocrinologist by training, so I'm a physician, practicing physician. I'm also Deputy Medical Director of probably the largest diabetes center around, Imperial College of London Diabetes Center, which is under Mubadala Healthcare. I'm also founder and chairman of my own medtech company, Sonostic LLC. I think that covers it.
Thank you. And then Alexandra from Sarissa Capital.
Thank you, Alex. My name is Alex Denner. I founded Sarissa Capital. At Sarissa Capital, we have been around for about 6 years. We do investing in healthcare companies. We look for companies that have a lot of value to create and typically join the boards of the companies and work with management and often bring in new management to optimize the value for shareholders and bring new innovation into the space. Thank you.
Thank you very much. And then Dr. Prasanth Manghat from NMC Healthcare.
Thank you, Alex. Myself, I'm Prasanth Manghat. I'm the CEO and board member of NMC Health. NMC Health today is the top 4 healthcare company by market capitalization. We are almost like $8 billion company. We are spread in 19 countries, predominantly doing almost everything on the healthcare delivery side. We're number 1 leader in fertility services. Very recently, very active on the technology and innovation space.
Wonderful, thanks so much. And then briefly about myself, my name is Alexandra Bause. I'm one of the co-founders of Apollo Health Ventures. And we are an early stage venture capital firm focusing on biotech that basically with the mission to enhance health. So I think we have a great diverse panel here that covers basically the full value chain of healthcare innovation, from conception of the innovation over to really building innovative companies up to applying and integrating the healthcare innovations. So maybe I can start with Alex. So when you look at healthcare innovations, what are the key criteria on which you think that an innovation will actually be eventually successful? Like, what are the key identifiers?
Okay, we look for products that are, I guess, truly innovative in the sense that are going to affect the treatment of patients in a way that's differentiated. A lot of the pharmaceutical industry over time has been more focused on sort of, kind of small improvements. That's appropriate and that's good, and that's not necessarily a bad thing. But our area of focus is looking for companies and technologies that have leapfrog technologies or very innovative kind of products where you can dramatically ameliorate or even cure disease. The types of companies we look at can be small or large. They typically have, we typically look for teams that are very passionate and enthusiastic about the technology. And if those teams don't exist, we try to match them with the technology that we find very exciting. One of the things also that is a trend that's not, it's not that every investment we have is like this, but we look very much for, we think one of the most exciting areas now is looking at diseases that are, kind of prevalent later stage in life. So, cardiovascular disease, diabetes, cancer, although oncology, there's a lot of work being done there now, a lot of really wonderful, exciting work, which I'm sure we would all like to talk about. But, in cardiovascular disease and diabetes, which are two of the largest causes of morbidity and mortality around the world, there has not been that much innovation relative to, sort of, say, oncology in the last decade. So we're sort of, we tend to sort of like those kind of products. And many of them, you can make a pharmacoeconomic argument that a product like that can be sold at a price that would address a large number of patients and be a win for the patient, a win for the shareholders of the company. There's a fly here, and a win, most importantly, for society, so that kind of everyone benefits.
Right. You actually were involved in a company, the medicines company, that is developing one of those therapeutics for cardiovascular disease. Maybe you can comment on the real innovative angle of that company.
Sure. That's a very exciting story. So we got involved with the medicines company a number of years ago. The company has a very high technology approach to reducing cholesterol. It's something called interference RNA, and basically what this product is, it's not yet approved. It's an injection that, if given twice a year, lowers cholesterol by 50%. So although it's not technically a vaccine, it sort of effectively works like a vaccine against cholesterol. We think that this product, if used broadly, could have amazing positive public health implications around the world. We took an investment in the company a number of years ago. We changed the board of directors of the company and the management team. I became chairman, and we appointed a bunch of new directors, and we focused the company in on this sort of thing. And just a couple of weeks ago, we sold it to Novartis for $9.7 billion, which is the highest price ever paid for a technology that's not yet approved by any regulatory agency. It's not even actually yet submitted to the FDA or anywhere else. But it is something that I think Novartis would agree is a product that, after appropriate additional clinical work, like primary prevention outcome studies, you could see this sort of a product being used broadly in a very broad population around the world, and it has the potential to basically take cardiovascular disease off the list of top 10 causes of death.
That's great. So when we're thinking about the high unmet need in these types of diseases, like chronic diseases like diabetes, cardiovascular disease, oncology, and neurodegenerative disease, what does, Dr. Al-Mansoori, what does the government, and you're a member of the Federal National Council, what does the government do in terms of incentivizing to bring these innovations into the healthcare system?
Well, first of all, I'd like to comment, Alex, it's very exciting, so I'm looking forward to that product perhaps one day coming.
Thank you.
An answer to what you're asking me is that a lot of time, money, brain power in the UAE has gone into innovation. We have many visions, and we've already put down the framework to kind of make our way there. We've done a lot in the last 48 years, and we're really much looking forward to the future. One of the most important things about innovation is understanding, what does it mean to us? What does it mean to you? What does it mean to me as a physician? What does it mean to the patient? And I really think at the end of the day, it's all one and the same. But we do have to understand everyone's perspective. I really believe that the bottom line at the end of the day is quality of care, quality and access to care. And I think the United Arab Emirates is, poised to become a hub for innovation, because we understand that. We understand that the quality and end goal is something that we really have to focus on. And I've always argued that if you bring the quality and betterment of the health of the individual getting the treatment, everything else would kind of follow, whether it is your margins or whether it is sustainable healthcare, et cetera, et cetera. So basically, we need therapies or technologies that work. We need therapies and technologies that are kind of having good results with our patients, and also that are accessible and affordable. And I think that all comes down to changing or encouraging this kind of way of thinking more 360 degree, more globally. It's not just about making a medication. It's not just about creating a new technology. It's not just about building a building. It's not just about training the physicians. It really comes down to what is quality of care, what is your end goal, what is the best care.
Absolutely. So Prasanth, within NMC Healthcare, I understood that you have a very unique approach in terms of bringing in innovation. So maybe can you comment on how do you actually identify the unmet needs based on your footprint, based on the practice that you do at NMC? And then how do you work at bringing in the relevant innovation and applying it to your business?
Thank you. I'm not a clinician by profession. I'm a finance person who finally entered in a healthcare company CEO. But I completely agree to Dr. Hawaa, what she's telling, that if the end goal is going to be clinical outcome-based program, if quality of care is going to be the motive behind everything that we are going to do, then the innovation has got some sanctity in it. The last 50 years, if you really look at it, what science and technology has brought into the medicine, the life that has changed is much more than the 200 years before that. But in the last 50 years also, the way in which healthcare is treated, the way in which patient is treated is the same. The industry is slightly different to other industries where the customer remained the doctor and the consumer remained the patient. And throughout this history, if you look at it, patient never became the center focus of the entire healthcare system that we talk about it. We have been throughout focusing on, things which is not patient focused, but to appease maybe sometimes regulator, sometimes the provider of services, or the corporates, or the insurance payers, or whoever it is. That itself has been the stumbling block for the entire e-revolution that is happening in the world, where we saw in mobility, we saw in transportation, we saw in your retailing, where entire thing changed. But healthcare never moved into the innovation platforms, mainly because patient was never a center focus. What NMC has done is, we have created a CEO research circle. That is our nucleus of our innovation. This has 25 doctors who work across the world with us. We have 3,200 doctors working with us globally, full-time with us. Of the 2,200 doctors who are working globally, 25 doctors come into what we call a CEO research circle. The CEO research circle gets all the ideas that are coming in, which are exactly as Doctor said, that the problems that are faced by a clinician, to the technician, to the patient. It could be as simple as, why should I move my simple linen 300 times a day or 300 times a week in the same corridor of NMC to how can I improve the clinical pathways by not giving antibiotics to my pediatric patient who is just less than 1 year when he or she has a simple dysentery. So these issues may be very simple and small, but they all finally culminate into the problem of the patient. So this CEO research circle identifies and assimilates all the ideas that are coming in. And the CEO research circle is headed by a Nobel Prize winner, Edward Moser, and other two more, one from Japan and one from UK. These three Nobel Prize winners, where Edward Moser is a chairperson, they goes through the entire ideas that are coming in, and the finalized a few ideas are put into action through an innovation team, which is a digital transformation team, who scouts for ideas across the world. And that ideas are then developed. It could be as simple as a venture capital investment, or to bring them as a startup, or to invest on this on the asset, or maybe try to help them to develop. So we say we can be a co-developer, we can be a co-investor, or we can be, we can sit and just validate as a co-validating partner. So we are three of them. 8.5 million people walk into NMC's facilities across the world. That's a very big data that we are talking about. So that knowledge, if we want to really transform into a result, the innovation partners, today if you really look at it, startups are standalone, healthcare providers are separate. They are two different compartments. So we are trying to do is that connect the startups with their ideas, give them the platform of NMC to develop, and try to do that. Very simple example, I'll just do and finish off my thing. We started working with an American company named Analytic. Analytic is an American startup who started working on AI to predict X-rays and CT scans. And that's becoming a big company, valuations are going up. Definitely we are working with them on that particular platform, but what we are trying to use them is on simple as revenue cycle management. How can we reduce the time that patient is waiting in order to get that approval from insurance company? It's a very complex database, 250 algorithms a human is checking when you go and give an insurance card. None of us as a patient doesn't know that. 250 Excel columns and rows, a front office lady is looking at it before you enter into the doctor's chamber. That should be taken out. How can you take out those things on it to an IVF, which is a fertility business, we are into that. So what I'm saying is that we are using that platform to connect. NMC CEO Research Circle will be a platform to connect the startups who are coming in with a lot of ideas, but doesn't have the real problem set in front of them, and we give them the problem set to sort out. And that is what we believe NMC should be able to do that.
Right. So all innovation should ideally come based on a clear unmet medical need and then developed around targeting that unmet medical need.
Can I just briefly follow up on what he just said, just very briefly? I like what you're saying. There's 2 points I'm going to make. First of all, as a government here, we understand that it's a spectrum. It's not the investor on their own. It's not the scientist on their own. It's not the tech, the AI people on their own. It's really a team effort, and it's a spectrum. And we're working on building, and we have already, and we're modifying the infrastructure to support all aspects, from the student in high school, university, to instill that idea of innovation, to that IT specialist that might be abroad. We draw them in, giving them reasons to come here. Everything from you can achieve your goals here, we have financial support, we have the will to be innovative, to hospitals, encouraging them and incentivizing to think outside of the box, as you said, Alex, not the same old, there's different classes of drugs, and let's just use a different class, to be more innovative than that, to actual policy to support that environment, to be an innovative hub. So I 1,000% agree with you. At the end of the day, we still have to remember, as you said, the core is the patient, and everything else kind of revolves around them. The second point I like that you made even in the discussion room is the importance of sharing data. There's a lot of data. Right now, there's a million points of data you could analyze. And as my IT people friends would say, you need quality data in to get quality data out. So I think sharing data across services, across centers, hospitals, countries is important, because as a clinician, I can tell you a simple thing, like what is a normal LDL? You could argue that we already know. You could argue that we actually don't know. Because the most simplest example is vitamin D, and I've mentioned this before. We don't know what the normal is because all the studies have been done on Caucasians. So again, having all this data at our fingertips is great, but focusing on actually analyzing it and getting the benefit from it and then applying it in healthcare and innovation is an absolute must. Otherwise, what's the use of having all of this data there? And for that, we need a very strong IT infrastructure. We need specialists in AI and that cross-specialty collaboration between the clinician, who knows the end user, and the AI and IT specialists and the support of investors to do it.
Yeah. Coming back to the data part, actually, this is going to be we're in a really exciting time right now because we now have the technologies to actually acquire all of this data and then analyze this in a really efficient way. And this is going to be really relevant if we want to identify the right patient populations for a certain treatment and identify these patients early on to actually prevent disease from happening. And I think one of the key areas where we actually want to come in with a treatment very early is neurodegeneration. So we see, especially with the aging population, we see a lot of, a burden of neurodegenerative diseases. And once we come in to treat them, a lot of times it's already too late. So we are working on identifying these diseases very early on and treat them before they actually wreak havoc. So one of the companies that's really on the cutting edge of neurodegeneration is Biogen. And Alex, maybe you can comment on how Biogen is working in the neurodegeneration space and bringing innovation into the clinic.
Sure, I'd love to. And just quickly before that, on this concept of data, one thing I think this region, maybe it would be an interesting way, that can provide value is, with the medicines company, we were looking at, populations where there was centralized healthcare that you could quickly access lots of patients, and Saudi and UAE were sort of populations that were unfortunately so-called enriched in cardiovascular risk, but there's a large population that there's pretty good IT systems now. You guys would know better than I about how good, but that's something that you could use a clinical trial and sort of produce value for patients. For the economies of UAE and Saudi and for the world potentially. On neurodegeneration, so I think this is a very interesting area, Alex, and it's sort of, I think it's one of the sort of more exciting areas within biotech and arguably one of the cutting areas in biotech. It's a little bit trite to say, but there are some people who sort of say that there's been a lot of progress, sort of, thank God, in oncology over the last 10, 20 years. It's still a horrible disease. It's largely not well treated, but at least people understand the disease. Neurodegeneration is kind of where oncology was 10 or 15 years ago, I believe. And at Biogen, we have a very significant effort in that. That's one of our portfolio companies. I'm on the board of Biogen as well. And a very significant area in a whole bunch of neurodegenerative diseases. The one that's been the most prominent recently has, I guess, obviously been Alzheimer's disease, where the company has spent many billions of dollars over the past few years doing work on Alzheimer's. And one of the particular programs, an antibody against one of the plaques that shows up in the brain of people who get diagnosed with Alzheimer's disease, called beta amyloid, which is a somewhat controversial hypothesis as to whether removing these plaques will do anything. The concern was, are the plaques kind of part of the cause of the disease, or are they part of the sort of the effect of the disease? But Biogen recently, through a little bit of a roller coaster and kind of a flawed study, basically, but the sort of the net is that we've recently shown that this particular antibody improves outcomes in Alzheimer's patients, and the data set is sort of imperfect, but it looks like a very strong, statistically significant result. Those results were presented publicly. I guess I'm losing track of time, but just earlier this week at a medical conference. So that's something that we think that drug will be sent to the FDA, and if approved, that drug could be sort of the first step in. It's not, unfortunately, a cure for Alzheimer's, but something like that. First, it has enormous potential. It could literally be the biggest drug in the world if things were to work well, and the FDA has to look at it and decide if it makes sense to approve it, and that's something they have to take their time to do. But it's the first step toward looking at many other neurodegenerative diseases. And I think that I'm hopeful, and we're certainly, positioning our portfolio such that in the next 5 to 8 years, there should be hopefully there'll be a number of sort of innovative breakthroughs like that, where you see some diseases that are basically not even understood what's going on with neurodegeneration, that you have some amelioration of those diseases from therapies.
Right. So can you comment on the pipeline at Biogen in terms of other novel, innovative treatments that are being developed in those indications?
Yeah, Biogen has a very large pipeline. We spend, $2 point something, low $2 billion per year in research. It's a very exciting pipeline. And there's an alpha-synuclein. So basically, I guess, the pipeline is largely neurology, neurodegenerative diseases. Because the company does a lot of broad research, we end up doing research that ends up being applicable to other areas. Like, we presented data in lupus, for instance, that's relatively interesting. So, I'm particularly excited by the Parkinson's program there. That's a disease, again, that's largely untreatable. It's a disease of aging that it's really not understood what's exactly going on. I think people are each month the medical community is understanding more about that disease, and I'm hopeful that there should be a sort of a therapeutic intervention that could ameliorate the disease. The current therapies, dopamine is basically all there is right now.
Right. It's mostly symptomatic treatments.
Exactly.
So we've talked about cardiovascular disease and metabolic disease and also neurodegenerative disease. Another key indication or another key unmet need that also comes with the current society and the current aging population is infertility. And I think NMC Healthcare is one of the global leaders in fertility clinics. Can you comment on how you are really innovating fertility treatments and providing the most innovative applications there?
Yeah. No, NMC definitely. We started the business 4 years back on fertility services. Today we are number one by far, the leader in the world. Spread in 14 countries, 75 clinics across the world, leader in almost all the Europe, and now started entering into US in a big way. One thing which has been amazing us, or perplexing us actually, that's the 1 in 6 couple in the world has got a fertility problem. And the fertility problems are treated with women on the centerpiece, where 45% of the fertility problems are male problems, which is generally not coming into the larger IVF per se treatment. 15% of the global population has got a problem of fertility, and not even 1% of the population, not even 1%, it's definitely much below 1%, goes into fertility treatment. Not treatment, that goes into the clinics to find out the problem. And the services are offered between $8,000 to $15,000 anywhere in the world. There are exceptional countries, but 90% of the world treats between $8,000 to $15,000. Success rates are predominantly between 30% to 50%. So that means if you spend $15,000 and your success is only 30%, there's a probability of you paying $50,000 for getting a child. And if you look at the top 5 in the world, we are just 4% of the total IVF market. So it's highly fragmented market. So that itself is the big problem, because it's so fragmented, exactly as Dr. Hawaa mentioned, Alex mentioned, the data and the seamless integration of knowledge is what is missing in the industry. Because of data is not well managed, the seamless integration of knowledge is not there, the cost of delivery and the success rates are becoming so exorbitant that majority of the people in the world cannot access this.
So the key is that we really need to improve the success rates,
we have
and
been
that's where
investing
the
on innovation
come.
in order to improve the results, the clinical outcomes, in order to ensure that, with less intervention, we are able to get the results.
Right. So thank you very much. We're already over time. Thanks so much for this amazing
Thank
panel.
you for having us.
Thank you.
Thank you.
Thank you very much.
Thanks, everyone.
Thank you.